Good morning, everyone, and welcome to the Institute for Work and Health's speaker series. My name is Arif Jetta, and I'm a scientist at the Institute for Work and Health. I'm also a co-chair of the speaker series committee, and so I'm delighted to welcome you all here today. And I'm particularly delighted to welcome my close colleague, Dr. Monique Gignac, who will be delivering this week's speaker series presentation. Before I introduce Dr. Gignac, there's a couple of housekeeping points that I just want folks to be aware of. The first is that Dr. Gignac will be taking questions at the end of the presentation. We ask folks to use the chat box or the Q&A function where you can then enter your questions, and we'll try our best to get to as many questions as possible, but we do know that there are a lot of folks who will be attending today, so we'll try our best. If we're unable to answer your questions in today's session, Dr. Gignac will be posting her email address at the end of her presentation, and you can email her directly. We also wanted to highlight that closed captioning is available. You can click the closed captioning button, which is available on the bottom right-hand side of your screen. And without further ado, I'd like to welcome Dr. Monique Gignac. Dr. Gignac is a scientific director and senior scientist at the Institute for Work and Health, and a professor at the University of Toronto's Dalla Lana School of Public Health. Her research expertise is in the areas of health and social psychology, including health models of disability, and her particular interest is on workplace communication, privacy, support, and accommodation needs among individuals living with chronic and episodic health conditions. In today's presentation, Dr. Gignac will be talking about the unveiling of the JDAPT, a new interactive tool to identify work-related support strategies for workers with chronic conditions and disabilities. For those who are unaware of the JDAPT, it stands for the Job Demands and Accommodation Planning Tool, which was designed to help address the complexity of disclosure decisions. It was developed as part of a large research partnership with input from researchers, health charities, people with lived experiences, and workplace representatives. So Dr. Gignac will walk us through the design of this tool today and provide some data from two specific studies which introduce the JDAPT. So with that, over to you, Dr. Gignac.
Thanks very much, Arif. And as Dr. Jetta said, I'm going to be talking about the Job Demands and Accommodation Planning Tool. This is, as mentioned, a part of a very large partnership grant. So we call ourselves ACE, the Accommodating and Communicating About Episodic Disabilities. So I want to just acknowledge the research team and the many individuals at the Institute for Work and Health who have participated in the research and in aspects of developing or testing the Job Demands and Accommodation Planning Tool. I also want to acknowledge the tremendous partners that we've had as part of this research. A number of health charities, different groups that are listed here, who have been working with us for several years on behalf of their communities and who've provided a lot of input and time with the different aspects of the project. We also have an expert advisory committee made up of individuals with lived experience who have been really wonderful as we work forward in some of the communication work that we're doing with communication tools, and many of them have also been involved in the JDAPT. And finally, I'd like to acknowledge our funding. We have been primarily funded through two large federal granting agencies, the Social Sciences and Humanities Research Council of Canada and the Canadian Institutes of Health Research. But we have received additional funding that's been very important from Canada Life in the early development of the tool, from Mars last year, and from Employment and Social Development Canada for dissemination work. So let me actually begin at the end with a few takeaway messages that I hope you'll come away with at the end of the presentation, and I'll unpack each of these messages as I go forward. So the first is that people living with chronic disabling conditions are often unsure whether or how to communicate workplace support needs. Workplace representatives and workers are often unaware of the types of support that may help meet needs. So the Job Demands and Accommodations Planning Tool focuses on work demands. It takes a different perspective. It doesn't focus on medical diagnoses and symptoms, and it provides concrete support and accommodation ideas that will hopefully be useful to people. Our early evaluation of the JDAPT is positive in terms of its usability, comprehensiveness, relevance, and some outcomes examining the provision and uptake of support. And I'll go through some of that with you. But let me give you a little bit of a context before we start. Statistics Canada tells us that there are about 6.2 million Canadians who are aged 15 years or more who live with a disability. And when we use this term disability, I'm not talking about a character trait or a state of being of a person. The World Health Organization emphasizes that a disability really reflects a limitation in an activity that arises as a result of the interaction between a health condition and personal and environmental factors. And they include things like attitudes, policies, inaccessible physical environments, and limited social support. Why that's important is it really emphasizes for us that we can ameliorate a disability by sometimes taking action in the environment and the world around us. And so that's what we want to think about, not just a health condition that a person may be living with. Over 60% of disabilities in Canada are thought to be episodic or dynamic in nature. And what that means is that they're often recurrent. So people may have periods of time when they feel well, they may have periods of time when either their health or their environments create more limitations. And so sometimes disability can also be progressive if a health condition changes and gets worse over time, and sometimes it's highly fluctuating. Also important is that many episodic conditions are unpredictable and invisible to others. And so a person can be doing everything that they should be doing to try to manage their health and still have flares or episodes, and others often aren't aware of it. And so I've listed a number of mental health and physical health conditions here that are examples of what are often thought to be episodic conditions. And you can see long COVID has been added to the end. We don't have a lot of data at this point on long COVID. We do know that it is disruptive of work and that people can have a variable experience with long COVID. And so over time, we hope we'll have more data about it. But so far, it's looking like an episodic condition. So this changing, unpredictable, and invisible nature of disabilities really creates a couple of challenges in workplaces. The first is around disability communication, disclosure, and the protection of privacy, which many individuals want to do. And the second area of challenge comes from providing support or accommodations while trying to maintain productivity. So the goal of this ACE project, that's partnership group that we're all part of, is to improve this communication support process for people living with episodic disabilities in an effort to try to enhance people's ability to gain and sustain employment. If I were to depict this very simply, we would note that individuals often have problems or support needs at work, and they struggle with, should I say something and what can I do? And so ACE is working on two separate tools. The first is a communication decision support tool, and that hopefully will be available before the end of the year. And the second is the job demands and accommodation planning tool that I'm going to talk about today. But before I get into the specifics of the tool, I just want to give you a little bit of the context around communication and the complexity of communication in terms of what people are dealing with. So we've done 5 surveys in Canada, and there are other researchers who are doing some of this work also in Canada and elsewhere. Our surveys have had about 3,400 people total. And anywhere from a quarter to about half of people tell us that they have not shared any information about their health at work with their supervisor. Now, there's no single correct communication decision. So we hear positive and negative outcomes from people who have disclosed and from people who haven't disclosed. So for example, people who do decide to share information sometimes say that they have received greater support, greater understanding, and got what they needed. At the same time, we sometimes hear people say that now they feel they have to prove themselves all the time. People know there can be stigma, gossip. People sometimes perceive that they have a loss of reputation as a good worker. So that might mean for people, they might think, well, maybe it's better not to say anything. And sometimes that does result in less stress, less concern about how others view you. But at the same time, people will tell us that they then don't get support, that there's often an absence of support, and there can be misperceptions about the reasons for job difficulties. And what I mean there is that not saying something doesn't mean that a person isn't always having an easy time of it. So they may struggle with some activities. There may be more absence from work, or productivity is lessened. And so in the absence of knowing what's going on with an individual, people sometimes jump to conclusions. They don't know that this is maybe related to a health condition, and a person's kind of leaking symptoms. And so there can be misperceptions, an assumption that this is not a good worker, this person doesn't get along well with others, this is someone who isn't motivated or skilled. So that can be one of the negative aspects of not disclosing. Just a little bit more information to show you some of the complexity around communication. We recently completed a survey of 737 workers who were living with either a physical or a mental health condition, in some cases both. We asked a lot of questions about communication. In terms of the need for support, we had about 56% of our participants told us they had considerable needs for support. So they were struggling with getting work done. Their job had changed, making it more difficult. They were worried about the future. Others were noticing. So they had a number of people had needs for support. Then we asked about preferences. Here we see a lot of variability. About 30% of people said they were willing to share and they thought sharing was important. So they had a preference for saying something. But about 36% of people were reluctant to say anything. They felt they were private, or they'd had bad experiences, or they just didn't want to talk about their personal needs. And another 34% were unsure. So they could see the benefits of sharing, but at the same time, they had concerns. We asked about organizational support, and we found that about 70% of people in this study did have some supports. So they had paid sick days or benefits. They knew about some accommodation policies and practices. But when we asked about the culture, only 20% of people reported that they felt their organization had a positive culture for sharing and few barriers. We had about 23% were unsure. So they said, yes, it is a positive culture, but at the same time, I am very worried here about some gossip and stigma. And a full 57% were unwilling, reluctant to share. They didn't feel that they had a positive culture in their workplace. So this is, even in this one slide, you can see how complex it is. People have needs, they may have supports available, but their personal preferences or their organizational culture may make them unwilling to share. So the bottom line for all of this then for us was that workers are looking for guidance on whether to communicate, how to share information, or how to get support when they don't want to share information, and what to share. Workplaces, we've done a number of workplace studies. They're looking for a transparent, consistent, and comprehensive approach, but something that will also meet individualized needs. And both workers and workplaces are looking for support and accommodation ideas. So this is why we created the JDAPT. We wanted something that was easily accessed. So this tool is online, it's free to use. We also wanted something that was personalized. We did a lot of looking around, and an awful lot of tools give you lots of lists, pros, cons, do's, don'ts, think about this, that, and the other, making it hard to wade through a lot of information. So we wanted something that would be more interactive, of course, evidence-based. We wanted also something that took more of a prevention and support framework. Right now, we see a lot of very reactive crisis-based management, and we wanted to create something that maybe would be something that could be used earlier, something that would promote discussion and brainstorming, because we know we can't provide specifics for every job and every health condition. So we wanted the JDAPT to have enough breadth and depth that it would be useful to people, but still recognize that, maybe people can come up with some ideas as well once they see what's in the JDAPT that might suit their own needs. Wanted something that would emphasize skills and abilities and not just focus on problems, would improve outcomes, and would protect a user's privacy. And I will come back to that a little bit more as I move through the presentation. So the first thing that we did was a needs assessment. We reviewed existing research and publicly available tools. We conducted additional research, both with workers and with workplace representatives. We've held a lot of ongoing consultations with our partners, people with lived experience, other groups. We want to thank all the people who've been in our studies, and we developed a prototype. So what we did in this prototype was we focused on work demands that may be challenging at times or regularly. So rather than focusing on health or a disability diagnosis, and there are good tools out there, but they often focus on a particular condition. And so if someone is living with MS, they may not know that there's actually a very good cancer tool out there. So we wanted to take the health piece and focus instead on the work piece. So the JDAPT guides a person through a series of simple questions about their job tasks and working conditions. It then gives a personalized list of support ideas that are relevant to that individual's job demands and of course, the areas where they're finding it more challenging to work. And those ideas then can help, we hope, generate solutions. They can be kept by the individual who may not want to share any of this information with others, or it could be used to discuss support needs in a more concrete way where you're focused on a job demand and the things that can be done about it. We submitted last year the JDAPT prototype to an inclusive design challenge that focused on support at work for people with disabilities. And this was sponsored by Mars and CIBC. And we were very excited that the JDAPT was the grand prize winner of the competition last year. It's not to say that we're resting on our laurels. There's a lot more that we want to do, but this was a really important occasion for us in validating that there's a gap here and that there is a need here for this kind of tool. So what does the JDAPT do? It has 24 different types of job demands, and they're broken down into 4 different domains. So there are questions about physical demands, like does your job involve working with your hands? Cognitive or thinking demands, like concentrating for long periods, working with others, and working conditions, like working around distractions. Today, I'm talking about the worker version of the tool, which is available in English and French. And so that's a self-assessment that a worker does for their own health and condition. And again, they can keep it to themselves or share it. But we will have an organizational version that's we're just getting that ready now. And it will be up probably in early summer in the next couple of months. And the organizational version can be filled out by someone like a supervisor or HR or somebody else in the organization, either thinking about someone who may have a health condition and what they are dealing with, or even just generally, does this particular job involve A, B, C? And if so, here are different examples of supports and accommodation should a worker need that. And that might be important as an educational piece for a lot of organizations that are very much wanting to become more inclusive, more diversive in their staff, in terms of giving people ideas and steps forward to think about. So for each of those 24 different demands, a person is asked, is this an important part of this job? If they say no, they move on to the next question. If they say, yes, this is an important part of this job, they're asked to what extent it's difficult for them and whether this difficulty changes or is fairly constant over time. After finishing, they get a personalized summary report of the job demands, and then this is linked to a list of different support strategies and accommodations. So an individual can keep a PDF, so there are opportunities for the information that people complete to be saved in a PDF. If a person doesn't save it and leaves the site, it's gone. You have to fill it out again. It was very important to people to have data and information be private. We don't ask for personal information about who a person is, where they work. We don't save any data. We can't send an email because the data is gone after a person leaves the site, so that everything is very personal, private. I'm not going to go through this. This is just a screenshot of one of the first pages in the JDAPT. It shows you how it's kind of laid out with the 4 different domains. And people tell us after they finish answering a couple of questions, it's in a pattern. It's very simple. Is this important to your job? Do you have difficulties? Does it change? And so people feel that they move through, I think, fairly easily. That's what we're hearing. This is another screenshot. Again, not going to go into it, but on the left at the bottom there, you see 16 of 24. So this is a fictitious person who's completed the JDAPT, and they're telling us that of the 24 job demands, 16 of them are relevant to their job. And then over on the right side, you see a bunch of bubbles. And so the dark aqua bubble at the top is 8 of 16. So this person has identified that 8 of the 16 job demands are difficult for them, some or a lot of the time. And then it gives you the subsequent bubbles are the different areas of work where you can see where difficulties may be more common or less common. And in this case, 7 of the 16 also change quite a bit. So this is quite an episodic condition. So an individual would get that. They would again have an opportunity to save it, and then they move into different accommodations. This is not a screenshot, just to organize the information. We wanted to put down a lot of different examples here. So on the far left, this is a job physical demand that a person has physical endurance or stamina as a part of their job. They're having difficulty with it. So they would be given things they can try on their own, adjustments they can try at work that maybe they can do on their own, maybe they'll need some permission, and then formal accommodations, which usually requires some permission. So there's lots of different strategies. If a person hovers over any one of them, it opens up. And it gives them more concrete information about what we really mean by this strategy, so that they can focus on those. If not all of this is relevant to an individual, you can check along the left side those that are relevant to you or you think might be something that you might be able to ask for at your work, to make this a personalized list. So you can either save the whole list, or you can create a personalized one. Sometimes a strategy appears more than once, like taking breaks. So you could check it just once if you don't want to see it come up 3 or 4 times, to make it much more personalized for you. So this is just showing that if it was concentrating for long periods of time, a cognitive demand, new set of strategies, again, you can open it up and look at it. Same with working with others, a new set of strategies opens up. So moving on now to some of the evaluation. Is this working? So we've been doing our evaluation in different steps, and I would call this a real world outcome evaluation. So first of all, it's driven by existing theories around goal setting, behavior change, and so on. We've included the users and the people who would be most interested in this all the way through our development and testing. So researchers, people with lived experience, partners, and others. We've also recognize, and this is very important, that the JDAPT is going to be part of an existing system over which we won't have control. So this is not an intervention where you go to a separate set of classes for 3-4 weeks that we can control all the information. It's going to be plunked in to an existing workplace or will be used by people with, very different jobs and health conditions. And that's important. And the reason it's important is that we want to collect a lot of information then from people about their work, about their health, their perceptions and experiences, so we can find what works for who and in what situations. So that means we haven't used a randomized control trial here. We can't blind people to the intervention group they're in. They know they're completing the JDAPT or not. It's hard to randomize people to groups because of all the different health and work situations they have. And it would be artificial, as I mentioned, to control for or limit context. That's what we need to find out about so we can understand where this tool is working. So we began with a needs assessment, and I talked a little bit about that earlier. We then did what's called a formative evaluation or sensibility testing and some preliminary outcome effectiveness evaluation. I'll talk about that in a moment. Going forward, we'd like to do some implementation evaluation and look at the adoption of the tool more broadly. For all of this work, we've used a variety of different methods: in-depth interviews, focus groups, environmental scans and literature reviews, and surveys. So let me talk a little bit about the formative evaluation, the sensibility testing. What is that? That's basically what you do very early on when you're developing a tool to look at its comprehensiveness, whether it's understandable and relevant, its length, people's overall impressions, feasibility, and so on. And so here, this is very labor intensive. We had our participants all complete the job demand questions, and then an interviewer went through every single question with them and reviewed these different concepts, its comprehensiveness, its relevance, and so on. What we were looking for was that 70% of our respondents endorsed the tool on each of those categories that's listed above. That was the minimum level of acceptability for us. If it was lower than that, we knew we needed to make some changes. So we had 46 workers who lived with different physical and mental health conditions, 23 organizational representatives, and people came from diverse organizations as part of this job. And overall, we found that the sensibility assessment exceeded 70% for most of the questions. Often it was in the high 80s and the 90s. We did, though, add 3 new items to the tool and some additional examples for people. So we added a question about working in locations with no easy access to facilities for personal needs. So, for example, maybe no refrigerator to store medication, or no access to washrooms. We asked about work requiring participation in social activities or with social expectations, and work that relied very heavily on one or more sense, like a seamstress, sense of touch, or a cook who had a sense of smell and taste as an important part of their job. And these are just a few quotes. It seemed like you covered every piece, whether it was a physical piece, traveling work to work, what's happening, that's happening over and over again, or working long hours. It seems like you've covered everything. There were basically all of them that I go through in my job. It's basically everything I do at work. And then someone who said, I go in and just say, I'm dealing with a mental illness, and my boss says, what do you need? And I say, I don't know. I think the JDAPT might be better to help me to understand actually these 3 aspects of the job are what actually are difficult. So let's think about what we do with those. And so they have a range here of physical and mental health conditions. So that was very good to see that it was working across these different conditions and occupations. So the next piece of our evaluation has been, and I'll finish up with this, looking at longitudinal testing. So here what we're looking at is some preliminary outcome testing. We have 3 waves of data. We've tested people, or we've had them fill out a questionnaire at a kind of time 1, a baseline. They answered a lot of questions about their health, their job context and perceptions and demographics. After that, they filled out the JDAPT. And then they filled out their perceptions of the JDAPT. 3 months later, we've gone back to people. We've asked them, have you used the JDAPT? What do you think about it? And we've re-asked a number of those context workplace questions and health questions to see if things are the same or have changed. And then at 9 months, we'll be doing the same thing that we did at 3 months, asking about use, perceptions, and work changes and similarities. We had to find people, so we have a convenience or purposive sample of people with physical, mental, or both kinds of conditions. At time 1, the beginning of the study, we had 279 participants. 3 months later, we've been able to get back 211 people. That's over 75%, which is excellent. And we've just begun the 9-month evaluation, the follow-up with individuals. So I don't at this point know how many of them will come back. A little bit about who's in the study. We have 2/3 are women. Average age is about 40, but we do span right up to, from 20 to over 65 years of age in the study. We have most people you can see here with both a physical and a mental health condition. That's very challenging to work with that. And so we have a number of individuals in the study who are dealing with a number of conditions, a number of different types of issues related to their health, as well as people with either just a physical or a mental health condition. And I shouldn't say just, because that is challenging enough. We have about 21% of people who tell us that their disability is fairly continuous, but most individuals have a recurrent pattern with periods of time when they have less disability and other times with more. About nearly 17% with a progressive disability, and about 18% of people who say it fluctuates quite dramatically. In terms of their working conditions, we have nearly everyone, 97.5% of people are working full-time. That means going forward, we want to look at more people who are working part-time in our studies. I will say that people who work part-time, often they tell us, because this is from our other research, that their health condition is much worse, which is why they can't work full-time. At the same time, working part-time often gives people more of a chance to rest and get done other things that they need to do. And so sometimes at the workplace, they look like they're better off than people working full-time. We have about 18% of people on contract. You can see at the bottom here that we have a range of different sectors, but we don't have as many people in sales and service and hospitality. So again, going forward, like to get more of these individuals, as well as people more in primary industries, although we have about 16% of people who are in construction or utilities, manufacturing, and so on. All right, at time 2, we asked people, have you made any changes using the JDAPT outside of work? And we had about 72.5% of people said, yes, they had. Someone said it was empowering to see how much one can do on one's own, especially when I'm reluctant to being supported by HR. We had about 59% of people nearly who had made changes to manage their work and health at work. When we saw people who didn't make changes, we had 2 reasons, which were the primary reasons that people told us why they haven't made changes. The first is, I don't need to make any changes right now. I'm okay. I either have what I need, or at this moment in time, things aren't too bad for me. So again, that episodic nature. The second reason people didn't make changes, primarily that they told us, was that they were reluctant to share information with others at work. And so that again is where our communication tools are going to be important. So someone here noted that they had used both the full and personalized list of strategies when they were informed that they would need to return to working in the office some days a week, and the materials, the JDAPT materials, were very helpful. And then we had about 21% of people who actually used the tool to share and plan with people at work. So someone said, I used a list of strategies and accommodation plans, plus the language of the job demand summary to help me request a workplace accommodation plan. These tools were critical in helping me explain how my disability impacts my work and allowed me to think about solutions. The plan is still being finalized, but without the JDAPT, I wouldn't have had the courage to go through this intimidating process and advocate for myself in such an effective way. So that was very positive. Something else that we've done, and we're still analyzing all the data, is we've looked at changes from time 1 to time 2. So I mentioned that we had people when they first began filled out a lot of information about their work. We asked about self-efficacy. So this is a concept that tests or asks people about their confidence. So when people filled out the first questionnaire, they were asked about how confident are you with a number of items in solving problems that might arise related to your work and health. How confident are you in meeting your job demands, getting the work done? And how confident are you that you can handle the stress or you're coping well, or the uncertainty that comes? So there were a number of items there that we asked about confidence in handling aspects of work and health. We then followed up and asked the same questions at the 3-month follow-up. And the arrow going up indicates that people improved. They felt more confident in terms of their abilities to handle things. And so they, and this was statistically significant. Sorry. We also asked about whether people were having difficulty getting as much work done as others expected, and whether they were having work productivity problems. Asked this before anyone had ever seen the JDAPT, and asked it 3 months after they had used the JDAPT. What we saw here is that it decreased. So people reported fewer difficulties getting as much work done as others expected, and fewer work productivity problems. All of these changes were statistically significant. But a change can be significant and not be what we might call clinically meaningful. You don't necessarily see it out there. So we calculated something called an effect size. And basically, if you have a 0.2 or less, it tells you that, yes, okay, there's a difference, but it's not very meaningful. It's not really something probably I'd be able to tell in what's going on in a person's life that this has changed. If you have an effect size of 0.5 in that neighborhood, that's a moderate effect size. That's a more meaningful, more likely to be something that people would notice and feel is happening. And 0.8 or higher is a very large effect size. So what you can see here is that we do have large one large and some moderate effect sizes for a number of these changes. They appear to be meaningful changes. The work productivity is a bit lower, but it's not as low as 0.2, but we'll be watching this as we go forward. And then just finally, to give you a sense here, we had items that asked about perceptions of the tool itself. So that there were 14 items in total. 9 asked about positive perceptions. It's helping me to think differently. It's providing new strategies. And 5 asked about negative perceptions. It's missing important accommodations. It's not going to make a difference. It's not relevant to my job. When we looked at these 2 scales, positive perceptions were very high. And that was excellent. We also found that there were no differences by gender or age or type of health condition, job sector, contract work, union membership. In other words, people in these groups found that the positive perceptions were equally high. The tool seems to be working whether you have a mental health condition or a physical health condition, whether you're a union member or not. When we looked at negative perceptions, is it missing something? Does it make a difference? We found the scores were very low, which is not surprising given that the positive were quite high. About 41% of people probably were disagreeing with everything, given the scores were so low. But here we did find a few differences. We found that younger workers, those with a physical and a mental health condition, a progressive disability who worked on contract and were non-union, had fewer negative perceptions. I was a bit surprised by this because I did think that perhaps contract workers and union workers or non-union workers might have had poorer perceptions of the JDAPT because they sometimes have less resources. But I think that's in fact what's going on in terms of having fewer negative perceptions. Young workers are just starting out. Those with both a physical and mental health condition have a lot to deal with and are looking for strategies. The same if it's a progressive disability. Things are changing here. Contract workers don't have a lot of resources at work. So some of the strategies we're providing around other things that you can do, the same with non-union workers, may be more helpful. And that may explain why they are actually having fewer negative perceptions of the tool. So as we go forward, this is the end of the beginning, I guess. We will continue to do analyses with the 9-month follow-up. We'll look at similarities and differences in disability type and work contract, so we can, type of contact work, so we can see what we can improve here. We'll look at additional resources or additional research for adoption, and we want to continue to enhance the accommodation list. So as I mentioned, that it is available now. You can try it out. It's available in English and French for workers. We don't save the data. And the JDAPT for organizational representatives will be uploaded in a couple of months, and everyone who's here would be notified of that. So I'll stop now, Arif, and turn it over to you. I've left the website up there as well as my email if people want to get in touch with me.
Thank you so much, Monique, for a wonderful presentation. It's great to see all of this work come together, and it's exciting to see where things will move as the JDAPT advances and as the organizational version gets adopted and disseminated out into the field. So we have a number of questions, and there's over 400 folks in the Zoom call today. And so we might not get to everyone's question. So we encourage you to use a Q&A function if you do have a question. But if we don't get to your question, Monique has offered to answer questions over email. So feel free to send them to her. So I've synthesized several questions, and I'm going to kind of put them forward, Monique. And the first question, and this is kind of a high level question, you mentioned the importance persons living with episodic disabilities often describe, or the importance that folks will place towards learning skills to communicate and to obtain accommodations. To what extent should workplaces care about this topic? Why should an employer devote attention to a tool like the JDAPT?
So I think there are a number of reasons. I think right now we have labor shortages. So the labor market itself is changing. And so the labor shortages would be one reason why I think workplaces want to look at this. You have workers who, maybe it's a bit more of a workers' market. People can go elsewhere. They can get the benefits, this flexibility that they need So that would be one reason. I think, though, also more importantly, is we have a lot of skilled people, a lot of people with disabilities, and your research actually shows this as well, Arif, get a lot of education because they know that they may face challenges in physically demanding work or other kinds of work, have very good skills, but have these intermittent needs sometimes, particularly the episodic. And losing those people would be a real shame. There's really good skills people are bringing, ways of looking at work, doing work. And so I think we want organizations to recognize that the loss of these individuals is a problem. Retention, turnover, those are costly. So those are lots of reasons why I think organizations want to pay attention.
Great, thank you. So a lot of folks were really impressed with the amount of work that your team has done to test and evaluate and just consider the different implications of the JDAPT. But one person in the Q&A asked about the linkage between the personal version of the JDAPT and the organizational version. To what extent are those two tools linked, and how can they be used synergistically if they are linked?
Yeah. That's a good question. So they're very high, they overlap a lot. So the 24 job demands, they are the same. Where workplaces told us they struggled is we actually asked workplaces to consider a worker who may have a disability and ask them the difficulty question, is this difficult for this worker due to their health, or does it change? Workplaces said they had a hard time attributing it to the health. So we're going to ask about whether the worker seems to be having difficulty that may be related to the health, but they don't have to necessarily know. And I would say 90%, if not more, of the strategies are the same, but there are some things that workplaces can do that workers can't do. Workplaces can send people for training. They can provide people with bigger changes to their workstation or where they work, and that kind of thing. So we've enhanced the strategies to give workplaces more of the kinds of things that they are able to do to help a worker.
Thank you, Monique, for that answer. Another question is about the applicability of the JDAPT to different working contexts. And so several participants talked about or questioned the ways in which JDAPT can be used by folks working in different occupations or different industries or within different work environments. For instance, one participant talked about the relevancy of the JDAPT within the healthcare sector. Maybe you could comment on its ability to be utilized by workers across a diverse range of workplace settings.
I think this is an area where we would like to do more work, and it may be that it might even be appropriate where you have large sectors to do a JDAPT specific. So JDAPT for healthcare workers or JDAPT for forestry or mining. We do want to do more research there. I will say with respect to healthcare, we've actually had quite a few healthcare workers who've participated in the development and testing of the JDAPT. We have a number of questions, particularly working with others and the cognitive demands, as well as the physical demands that do seem to be relevant to healthcare workers and provide examples for that particular sector. We would love anyone who fills out the JDAPT. There is an opportunity at the end to kind of leave the tool, but send us an email about your ideas and strategies, areas where you think we could improve the tool. And we would like to be able to, on an ongoing basis, update it, as well as maybe carry out, as I said, some new studies to really enhance and focus on a sector if that's possible.
Great. Yeah, that'd be an interesting next step in the process.
Absolutely.
So we have a bunch of folks who are tuning in who represent work disability managers, workers' compensation, folks who might be coordinating the return to work process. And a number of them have raised questions with regards to the ways in which the JDAPT could be used to facilitate return to work, to be utilized within a workers' comp setting. So is the tool relevant to return to work?
It's an excellent question. I did want to just return to something you had said earlier. So this is, given that there are a lot of disability managers and others, even with clinicians, this is something that could be a tool that you sit down with a worker and work through it if the person is willing and doesn't want to just do it on their own. In terms of whether or not it would be relevant to injury and return to work, I think that it would be, but because very often we know when people do have an injury, they have, it's not the slip, trip, sprain, strain kind of, I'm going to recover and then I won't have to deal with this anymore. We have first responders dealing with the PTSD. We have other individuals who have been injured and have a more permanent physical issue that may be arising. So insofar as there is something that is ongoing, that is either permanent or episodic in some way, I think the JDAPT is something that people could be looking at for compensation, processes to work through that return to work and do some planning around accommodations.
Okay, so I have a related question, Monique, and one attendee asks about the subjective nature of the JDAPT and the fact that it relies on the workers' perspectives and perceptions of the work environment and how difficult it is for them. And I guess the observation or the reflection from this attendee was that when they're working in the work disability management space or the accommodation space, they are often requiring objective medical information to support the dissemination of an accommodation, or to support the planning or light duties or other types of modifications. And so how does this tool maybe either complement that or replace the need for objective medical information? Maybe you could comment on the kind of like the comparing and contrasting of these two kind of concepts.
Well, thanks for such an easy question. This is a big issue. It's very difficult with the subjective, objective truth with the capital T. Does it even exist? We know for many health conditions, there are subjective aspects, pain, for example, fatigue, for example. These are recognized as being real. They are important, but they're not always easy to assess. So the JDAPT, yes, asks for a worker's perception, and then there will be the workplace perception. To some extent, that will be subjective, but to other, extents, people can be saying, I'm not getting this done. It's not happening. So there can be objective elements that we're also tapping into this. I think the point of the tool is, if you do believe that there's an issue, to look at perhaps some support strategies that might help improve, again, those outcomes. I think in terms of clinicians, what we hear there with writing notes, sort of the more objective, I don't think the tool would replace that. I think organizations will still want clinicians to sometimes verify, but not all organizations do it that way. But sometimes, that it can be verifying that, yes, this individual is living with a progressive condition that causes a disability at work. That can happen still. Now, where the JDAPT is, I think, helpful is we hear from workplaces very often that the notes they get from clinicians are often not that helpful when it comes to the adaptations. They don't understand the job. They don't know what's going on. Their workers struggling as well. What could we do? So actually filling this out in those situations may be very helpful to the groups like clinicians or disability managers who want to make recommendations to a workplace, but don't necessarily always know the details of what that job involves. So I would see these as being quite complementary with this existing process that people have, but the process that we hear often breaks down.
Okay, that makes a lot of sense. So one of, I guess, a sentiment that's being expressed in the Q&A has been with regards to privacy concerns. And so there's obviously, this tool plays an important role in creating or kind of fostering conversation, or even just acknowledgement or awareness about challenges a person might be facing related to having and working with an episodic condition. And so some participants asked, to what extent should the findings from the JDAPT be shared to an employer? If that is the case, how do folks kind of support their privacy, which could have specific or very wide-ranging implications for accommodations or access to short-term or long-term disability? And so I guess, what are some privacy concerns that your team has accounted for in the design and implementation of the JDAPT?
So it's a good question. It's another tough one. Canada, I think, as probably many people know who are listening today, has duty to accommodate legislation. So employers are required to try to provide supports for people to the point of undue hardship. And that's where, of course, it all gets very complicated. So I think employers are aware that they do have an obligation here, that there is legislation around this. I think a lot of the challenges that we hear about were exemplified by one of those quotes where someone comes in and says, I have this problem, and you may have someone who's receptive, but it's like neither of them know what to do. So I think one thing we're trying to do here, again, by not focusing on the health, is, a person can go in and say, I'm finding that this particular job, I have a lot of distractions. They're really interfering with my ability to get some work done. And so I'd like to propose that maybe I could do X, I could move here, or I could have this happen. And this would really help me to deal with the distractions. None of that mentions that a person might have lupus, or they might have an anxiety disorder, or they might have fatigue because of pain. And so that was one way we wanted to try to get around some of this, is to sort of talk about, again, the job itself. I think in terms of sharing information from the JDAPT, I think this would be a good thing to let HR know about. And you can just say, I know there's these tools out there for people to help them think through, supports and things. You don't have to identify your own needs or condition, hopefully. At the same time, I do want to recognize, because we've done a lot of work on disclosure, that not everyone is in a situation where they have supervisors or coworkers who are supportive of their needs. And this is a real challenge. I would not say at all that people should disclose a health condition if they're not comfortable doing that. You're probably picking up on some very good reasons why you don't want to do that. But that's where the tool, hopefully in providing things that people can do without disclosing, or a way to talk about some job demands, just in terms of the demands themselves, and ways that we can improve the work that gets done, might be helpful to people.
Great. Thank you so much for answering that question, Monique.
But it's not a perfect world, and we do know that. So that we do want to work more on the communication piece as well, the privacy piece. So that's what the second tool is trying to do also.
Thanks for clarifying and adding to that. So we've had a number of reflections in the Q&A with regards to whether or not the JDAPT could be utilized by folks who have other types of personal experiences or challenges or difficulties. So some folks have talked about individuals living with a permanent disability, or those with childcare or elder care responsibilities. Also women who might be pregnant or having menstrual pain. And so I'm wondering, have you thought about other ways in which the JDAPT could be adapted to different populations? If so, how?
Yeah, thank you. Yes, we have. I think when it comes to the permanent disabilities, sometimes the tool might be it might be something the person does once, and then if they they have some ideas or some strategies, they can implement them, and that might be quite a game changer for them at work. With the episodic, I think the JDAPT may be something that people need to take more often. So that they can really focus on how things may be changing. I do think for issues like caregiving or other personal demands in someone's life, for other kinds of experiences, as you mentioned, for pregnancy and all kinds of different things. I do think there's a possibility here, a potential. People should try it out. We haven't done this studies yet, and we don't have the data, but because we're focused not on symptoms, we're not asking about a person's personal life. We're simply focused on the job demands. And if you're having difficulty with them, what might you be able to do to deal with those job demands? I think there still might be a lot of strategies then to deal with really quite a wide range of problems that people are having. I don't want this presentation to sound like it's an infomercial for a miracle, device here that we've created. We do need to do the testing, and we do need to, I think, expand on supports, because wherever there are new problems that people are having with work, there may be different kinds of solutions. So that would be important as well. But, it might take about 15 minutes of a person's time to fill it out, try it out, let us know.
Great. Okay, so we have one last question for you, Monique, and a lot of folks, given how excited everyone is about the JDAPT, there's questions about dissemination. So what are your next steps in terms of sharing the JDAPT to both workers as well as employer groups? How will folks be able to access this moving forward? How will folks be able to access other literature that has emerged as a result of the JDAPT? So what are the next steps in terms of dissemination?
Yeah, so this is something where, of course, we would love people's help. We do have dissemination plans. So all the partners, for example, with the JDAPT will be trying to reach out to their communities to share information about the JDAPT, to put things up, links up on their websites. And we're happy to have people link to the JDAPT from websites. And that would include a private companies. We want to reach out to the public service. We hope to be able to reach out to disability managers and HR professionals and groups that serve people with disabilities more directly, so that we can speak with them about how to do this in a way that would help their communities. So lots of that, more talks. The Institute will keep people up to date through the mechanisms that we have. So lots going on, but if you have ideas for us, if you have contacts for us, please do reach out.
Thank you, Monique. So again, folks, I know that we weren't able to answer everyone's questions today, so I would encourage you to send Monique an email if you have any suggestions on the ways in which the JDAPT can be used or disseminated. Please don't hesitate to reach out. We also encourage you to subscribe to the Institute for Work and Health's e-updates, event notifications using the link on this slide. So just to conclude, Monique, thank you so much for sharing all these insights. I know everyone is very excited to see where the JDAPT goes from here, and we look forward to future presentations regarding the JDAPT. I wanted to just highlight to those in the Zoom call today that our next speaker series will be held on April 18th at 11 a.m. Eastern Time. Dr. Emil Tompa, Senior Scientist at the Institute for Work and Health, will be delivering a presentation entitled Skills Development Barriers for Persons with Disabilities and Promising Practices to Address Them. So we hope to see you on April 18th, and have a wonderful first day of spring, everyone. Take care.
Thank you. Thank you, everyone.